Hello, everyone. We welcome you to an all new episode of our Health from Home series by Aditya Birla Health Insurance. Today, I, Dr. Sunil Chaudhary, an MBBS and a practitioner at Aditya Birla Health Insurance, would like to welcome Dr. Vinny Kantru, a pulmonologist, a gold medalist in MBBS, who has also been associated with Apollo Hospitals for past 13 years. And she is also a member of Royal College of Physicians, London. She was also principal investigator for Sputnik trial in India. Her interests are critical care, interventional pulmonology, interstitial lung diseases, and of course, music. She will help us understand and educate us on how can one breathe carefree in spite of having asthma, one of the most common chronic conditions. It is something that many people are suffering from due to many lifestyle conditions, global warming, pollution, etc. Welcome, Dr. Kantru, to our Health from Home session.
Thank you so much, Dr. Sunil. It's a pleasure to be here on this platform and to be of use to everybody in the country, because I have seen in my clinic that the most common thing which people have as a respiratory problem right from the childhood is something like a breathing trouble, which can be due to asthma. And it's really honoring to be here to be of help to the people through your podium. Thank you.
I'm sure with your vast experience in this field, you must have heard or answered so many questions related to asthma. And we have a few questions that I would like to read out in front of you and request you to please help us understand this situation a little better. So my first question to you, Dr. Kantru, is what is asthma?
Well, this is as simple as it could be understood, and with not taking the medication in the right way or in the right time, this could get as complex as landing you up in the ICU. So asthma is a breathing condition, as everyone knows. ये एक ऐसी बीमारी है जो ब्रीदिंग के ट्रबल क्रिएट करती है, और इसमें जो आपके सांस की लाइनिंग होती है, जो इंटरनल म्यूकोजा होता है हमारे ट्रेकिया का या ब्रीदिंग ट्यूब्स का, उसमें स्वेलिंग आ जाती है, और उस स्वेलिंग का कारण जो है इन्फ्लेमेशन होता है. There are certain triggers of this inflammation in and around our environment which can cause this type of chronic inflammatory condition, which thus leads to certain kind of symptoms, which are episodic breathlessness, cough, or production of increased amount of sputum, or for that matter, having breathlessness, which can create problems in your daily routine and not making you exercise even the normal amounts of exercise. So thus, this is an episodic condition which can cause wheezing, coughing, breathlessness, and cause a lot of comorbidities in you and make you a person who's sitting doing nothing and going on accumulating fat.
Okay. So, doctor, generally, breathlessness and certain symptoms, people may have these symptoms, but when do we say it is is asthma clinically, or when do we say that it's actually impacting your daily life and now it's a cause of concern and one should be visiting a doctor?
Definitely. This is a very good question, because initially on, when we are young, this doesn't interfere with our life. You might be having certain amount of wheezing, and since the problems are coming in episodically, they're coming in only on occasions. You might not seek help earlier on. So people who have problems like chronic cough, which are lingering on for more than 2 to 4 weeks, and they're not able to sleep at night, because not being able to sleep at night is something which can be a harbinger of asthma, because during the night, there is change in the temperature around you, which can be a trigger of your asthma problem, and you are having increased amount of nighttime symptoms with increased coughing, not getting the proper sleep, feeling very tired in the morning, and not able to do your daily routine. Now, this is something, when this happens in the childhood, it could just be that the child who's very small, who cannot speak, they're not able to take their feeds in the right amount or in the right manner. they're getting very cranky and the mother doesn't understand what is happening to the child. This often manifests in the form of increased amount of and production of mucus, which just comes out in the vomit of the child, and child stops taking any further feeding. So this can be alarming for a child because child is not able to get the adequate amount of oxygen, and especially if their tongue and their oral cavity or their lips turn blue, then that is a matter of concern. The mother should at once report to a pediatrician and show the child to a pediatrician. Now, as far as the higher age group is concerned, it could be between 2 to 12 years of age if we take the children.
Yeah.
They could be having something called wheezy bronchitis. They often have this wheezy bronchitis due to viral infections in the childhood, because the child has not been exposed to so many viruses which are there in and around our environment. So when a child is exposed to a new virus every time, they do get these wheezy episodes, and that could get better with time. They are not asthma, although the treatment might be same, but they cannot be equated to asthma. On the same hand, you should remember that such children जिन्हें ये wheezy bronchitis बचपन में होता है, उनको जो है एस्मा सफर करने की प्रवृत्ति बहुत ज्यादा बढ़ जाती है। हालांकि इसका ये मतलब नहीं है कि जिसको wheezy bronchitis बचपन में रहता है उनको नेसेसरीली एस्मा के बीमारी में लैंड करना ही करना है, ऐसा जरूरी नहीं होता। लेकिन हाँ, ये हार्बिंगर हो सकता है कि हायर एज ग्रुप में ऐसे बच्चों को जो है एस्मा की प्रॉब्लम आ सकती है, लेकिन wheezy bronchitis समय के साथ ठीक हो जाता है। इस wheezy bronchitis का इलाज भी सेम होता है जैसे हम एस्मा का इलाज जो है इनहेलेशनल मेडिकेशन से करते हैं, जिसके बारे में हम आगे बात करेंगे। इसके बाद जो हमारी एज ग्रुप आती है वो 12 साल के ऊपर की एज ग्रुप आती है। तो ऐसे लोगों में वीजिंग होना, ब्रेथलेसनेस होना, कफ का होना, इंक्रीज्ड म्यूकस प्रोडक्शन होना, या आपका रात को ना सो पाना, ये सारे सिम्टम्स जो हैं एस्मा के हार्बिंगर है। और ऐसे सिम्टम्स को जो है हमें इनहेलेशन, जो मेडिकेशन हम ब्रोंकोडायलेटर्स के फॉर्म में देते हैं, उनका इस्तेमाल करना बहुत जरूरी होता है। यदि आप इस प्रॉब्लम को इग्नोर करते हैं तो क्या होता है? हाँ, जरूर आपको ऐसा लगेगा इनिशियली आपको कोई प्रॉब्लम नहीं आ रही है, लेकिन विद टाइम जब ये इन्फ्लेमेशन, जो आपकी स्वेलिंग है आपके ब्रीदिंग ट्यूब्स की, एक लॉन्ग तौर पे जब ये इन्फ्लेमेशन लिंगर ऑन करती है, व्हेन दिस इन्फ्लेमेशन स्टेज देयर फॉर अ लॉन्गर टाइम, ऐसे समय पे जो आपकी ये स्वेलिंग है ये परमानेंट हो जाती है अनफॉर्चुनेटली, और फर्दर नैरोइंग होती है ब्रीदिंग ट्यूब्स की। यही कारण है कि जो हम इनहेलेशनल मेडिकेशन एक कम डोज में देते हुए पेशेंट्स को ठीक कर पा रहे थे, उनके सिम्टम्स को एकदम अच्छा कर पा रहे थे, आगे जाके जब ये परमानेंट प्रॉब्लम बन जाती है तो हमारी दवाओं का जो असर है काफी कम हो जाता है। इसीलिए आपको इस प्रॉब्लम को बिल्कुल इग्नोर नहीं करना चाहिए, और ये ना सोचते हुए कि हम स्टीरॉयड इनहेलेशन ले या ना ले, ये हमारी सेहत के लिए हानिकारक है। देयर आर लॉट ऑफ साइड इफेक्ट्स which are associated with inhalational steroids, which is not true. आपको ये सब चीजों के बारे में ना सोच के ये सोचना है कि किस तरह से हम अपने ब्रीदिंग ट्यूब्स को जो है एक हेल्दी लेवल पे ले आए और एक क्रॉनिक इन्फ्लेमेशन की तरफ पुश ना करें।
Yes. So, doctor, I mean, generally it is said that an experienced doctor would know, in OPD, the moment patient enters, from the wheezing sound itself, they don't even have to put stats sometimes. It's so loud. But what investigation generally one has to go through for the diagnosis of asthma?
This is a very good question. You have asked a very good question. Actually, जब एक पेशेंट को ऐसा अटैक होता है और हमें पता रहता है कि ये पेशेंट दिस पेशेंट हैज बीन हैविंग सच काइंड ऑफ सिम्टम्स, स्पेशली जो एपिसोडिक प्रॉब्लम्स होती हैं, एक बार आती हैं, ब्रीदिंग में डिफिकल्टी होती है, and the patient gets sometimes better on their own, especially in their childhood. तो ऐसे मरीज अगर हमारी इमरजेंसी में लैंड अप करते हैं एक wheezing साउंड्स के साथ जो कि ऑडिबल होती है, तो उस समय हमें समझने में इतना ज्यादा समय नहीं लगता है कि हाँ ये एस्मा का एक्यूट अटैक है या फिर एक्सरबेशन ऑफ एस्मा है। स्पेशली अगर कोई वायरल इन्फेक्शन भी साथ में हो। अब वायरल इन्फेक्शन के निशान ये होते हैं कि पेशेंट्स may get a fever, they might get a runny nose, they might get body aches, they might get joint pains, which signifies that they have had a viral infection which has been a trigger of the asthma. So ऐसे लोगों को उस समय पे कोई भी इन्वेस्टिगेशन जो जो स्पेसिफिक इन्वेस्टिगेशन होती है एस्मा की, वो पल्मनरी फंक्शन टेस्टिंग होती है, जिसमें कि आप एक मशीन में अपनी एयर को जितनी तेजी से फूंक सकते हैं और जितना जल्दी फूंक सकते हैं वो देखा जाता है। लेकिन अनफॉर्चुनेटली व्हेन द पेशेंट लैंड्स अप विद अस इन एन एक्यूट अटैक, this test is often not possible because of the breathlessness which the patient is suffering from. So from the clinical point of view, if the patient has been having these episodic problems chronically in the past and they have a family history of asthma in their immediate family, then we have to treat this as an acute exacerbation. And once these patients, when they are better, after 4 weeks, they can undergo the pulmonary function test, which will tell you that the FEV1 by FVC ratio, which are some of the volumes which are measured when you breathe out your amount of air which is there inside of your lungs as fast and as quickly as possible. That is actually the thing which we measure inside of your airways. Now, this is the velocity which is there of your air which is moving out of your breathing tubes. इसी velocity का कम होना इस चीज को दर्शाता है कि आपके जो ब्रीदिंग ट्यूब्स है वो नैरो हो गए हैं, उसमें रेजिस्टेंस आ गई है। कई बार ये रेजिस्टेंस जो है एक ब्रोंकोडायलेटर देने के साथ ही कम हो जाती है, जिसे रिवर्सिबिलिटी कहा जाता है। नाउ रिवर्सिबिलिटी इज अ वेरी स्पेसिफिक टेस्ट ऑफ एस्मा। यदि हमारे पीएफटी में ये रिवर्सिबिलिटी दिखती है तो उसका मतलब ये होता है दैट द पेशेंट इज हैविंग एस्मा एंड द सिंपलेस्ट क्योर इज अ स्टीरॉइड बेस्ड इनहेलर।
So, and this brings us to our next question, because the causes of asthma, as you said, there are some triggers, and it's generally considered as an allergic, reaction to allergens. So, what are the common allergens that may lead to asthma? And does stress also leads to exacerbation of asthma or initiation of asthma in some cases? What is your say on that?
Right. So there are very common things which are present in our environment which can trigger of asthma, and they could be present right inside of your bedroom. Now, the simplest thing which is present in your bedroom, especially if you're living in a metro city, would be dust. And the dust is attracted more on upholstery, on the carpets, which are usually thicker, which have more fur. So that is the reason we actually say that patients who have asthma should be avoiding a very heavy upholstery. They should be going for the cotton-based upholstery. The carpet should be kept bare minimum, and if you have to keep a carpet, they should be cleaned on a regular basis by a vacuum cleaner. So इस फर में, ये जो फर होता है या आपकी जो बेडिंग होती है, उसमें काफी डस्ट माइट्स होते हैं। सो ये डस्ट माइट्स जो पनपते हैं वो डस्ट के अंदर पनपते हैं। यही कारण है कि ये डस्ट माइट जब आपकी नाक के थ्रू अंदर जाते हैं तो एक ट्रिगर का काम करते हैं। दिस इज द मोस्ट कॉमन ट्रिगर which is present right inside of our households. The next one could be the fur of the pet who is inside of your house. The pet could be a cat. It could be a rabbit. It could even be the dog which is moving around in your bedroom. So अक्सर पेशेंट्स ऐसे आते हैं जिनको अपने पेट से काफी लगाव होता है और उनको दूर नहीं रख पाते। तो ऐसे पेशेंट्स को हम फिर कम से कम इतना कहते हैं कि एटलीस्ट उन्हें अपने बेडरूम में ना आने दें, ताकि उनकी जो बेडिंग है वो फर फ्री रहे। तीसरा जो कारण होता है, कई लोगों के ट्रिगर जो होते हैं कॉकरोच के प्रोटीन्स होते हैं। अब कॉकरोच तो इंडिया में काफी ज्यादा पाया जाता है, और अगर एक भी कॉकरोच घर में पाया जाता है तो डॉक्टर सुनील आप समझ सकते हैं कि चिल्लाना कहाँ से निकलेगा सबसे पहले। तो ये कुछ ट्रिगर्स हैं। इसके अलावा मौसम का बदलना, बिकॉज जो टेम्परेचर चेंज होता है उसके कारण भी हमारी जो एयरवे की स्वेलिंग है वो ऊपर नीचे हो सकती है। ये एक ट्रिगर एक्ट कर सकता है। जैसे आपने खुद ही बताया कि स्ट्रेस जो होता है, अब स्ट्रेस केवल मेंटल स्ट्रेस को नहीं दर्शाता, स्ट्रेस दर्शाता है हमारा ओवरऑल एनवायरनमेंट। दिस कुड बी द फिजिकल स्ट्रेस, इट कुड वेल बी द मेंटल स्ट्रेस। which we all suffer in this Kali Yuga. We have a lot of stress. We think about our work. We get our work into the house. We don't have any demarcation of office space of our houses, especially after the lockdown, and also erratic times of our eating, our food habits, which is more towards the fast food, not making and eating home cooked food. That could well be a trigger, because few people are allergic to food particles and food additives, especially जो आर्टिफिशियल फ्लेवर्स या ऐसे केमिकल्स यूज किए जाते हैं फूड को तैयार करने में या उनको प्रिजर्व करने में, ये भी कई बार जो है ट्रिगर साबित हो सकते हैं एक एस्मा के अटैक का। इसके अलावा जो ट्रिगर्स होते हैं वो वायरल इन्फेक्शन से भी कई बार जो है आ सकते हैं, क्योंकि इससे भी जो है इन्फ्लेमेशन आपकी बढ़ सकती है बॉडी के अंदर। और दूसरी जो चीजें हैं, एयर पोल्यूशन। एयर पोल्यूशन बहुत कॉमन है हमारे यहाँ। सल्फर डाइऑक्साइड, नाइट्रोजन डाइऑक्साइड, टॉक्सिक ओजोन, जो कि ओजोन हम सबको पता है कि यूवी रेडिएशन को पेनिट्रेट करने से हेल्प करती है डीपर डाउन ऑन टू द अर्थ। लेकिन उसी के साथ दूसरी तरफ अगर ये ओजोन अर्थ की पास आ जाए या हमारे जो एटमॉस्फेयर है निचले तौर पे उसके पास आ जाए, अगर हम ये गैसेस इनहेल करें तो ये काफी टॉक्सिक होते हैं। इनमें फ्री रेडिकल्स होते हैं। फ्री रेडिकल्स आप सबने केमिस्ट्री में पढ़ा होगा। इस तरीके से जो है ये रिएक्शंस होती हैं हमारे अंदर, फ्री रेडिकल मैकेनिज्म से एक चेन रिएक्शन सी बन जाती है और वो इन्फ्लेमेशन क्रिएट होती है। ये कुछ कॉमन ट्रिगर्स हैं। इसके अलावा भी पर्सन स्पेसिफिक ट्रिगर्स हो सकते हैं, जिस तरीके से हमने देखा है जिन घरों में वेटनेस होती है, द वेटनेस अराउंड द हाउस, उनमें कई बार हमने देखा है कई जगह पे मोल्ड या फंगस भी पनपता है। दैट इज अ वेरी कॉमन ट्रिगर ऑफ दीज एलर्जिक रिएक्शंस आल्सो। तो बेसिकली जैसे आपने खुद कहा डॉक्टर सुनील कि जिन लोगों को एलर्जी की प्रवृत्ति होती है उन लोगों को ये प्रॉब्लम बहुत ज्यादा होती है। दोज पीपल हु आर एक्चुअली प्रीडिस्पोज्ड टू एलर्जीज आर एट हायर रिस्क ऑफ ट्रिगरिंग देयर asthma attacks.
So, doctor, this also creates, there is some curiosity that I have, because in past I had been interacting with pulmonologist, and one of my good friend is a pulmonologist. He said it's like it's COPD is also another condition, but it's very difficult to differentiate between asthma and COPD. Only a pulmonologist can do this, and there's a lot of nuances there. Though theoretically they're very different, but clinically very difficult to actually differentiate between these two conditions. So, and how can one do that?
Right. So COPD is something which has almost similar symptoms, and sometimes the signs which we see inside a patient can be the same. But COPD is a condition which is usually seen in the middle age group. The onset is different as compared to asthma. Asthma is more common disease of younger population. It has been there because of the genetic predisposition which the person has towards the allergic mechanisms. So यही कारण है कि छोटी उम्र में ही एस्मा का होना ज्यादा जो है मैनिफेस्ट होता है, क्योंकि उनमें जेनेटिक प्रीडिस्पोजिशन होता है। वही सवाल रहा सीओपीडी का, क्योंकि सीओपीडी का सबसे कॉमन जो कारण होता है वो सिगरेट स्मोकिंग होता है। तो सिगरेट स्मोकिंग को हमारी बॉडी के अंदर वो चेंजेस लाने में, वो इन्फ्लेमेशन लाने में काफी समय लगता है। ये समय दो लोगों के बीच में अलग अलग हो सकता है। किसी की इन्फ्लेमेशन 5 साल में, 10 साल में, या किसी की इन्फ्लेमेशन 20 साल में, 40 साल में बनती है। तो यही कारण है कि जो सीओपीडी का एज ग्रुप है वो मिडिल या एल्डरली एज ग्रुप होता है, उस समय ये मैनिफेस्ट करती है। और दूसरी चीज, जैसे मैंने रिवर्सिबिलिटी की बात की थी, एस्मा में रिवर्सिबिलिटी होती है एयरवे में, यानी कि अगर आपके जो ब्रीदिंग ट्यूब्स है वो नैरो हो गए हैं, उनको एक ब्रोंकोडायलेटर देने से वापस जो है हम उनका साइज इंक्रीज कर सकते हैं, उनकी विड्थ बढ़ सकती है। वहीं सीओपीडी की जो ये नैरोइंग होती है एयरवे की, ये फिक्स हो जाती है। और कई बार जो इनहेलर्स जो हम यूज करते हैं उससे इन्फ्लेमेशन तो कम होती है, लेकिन ब्रोंकोडायलेशन यानी कि उनकी साइज वापस अपनी लेवल पे एक बड़ी विड्थ के साथ आना मुश्किल हो जाता है, क्योंकि वो फिक्स हो चुके हैं एक जगह पे, उनमें फाइब्रोसिस का ऑनसेट हो चुका है। और उनका जो लचीलापन है लंग्स का वो कम हो जाता है. The elasticity of the lungs decreases in COPD. That is why there is a problem, and hence there is no amount of bronchodilation which can happen in these kind of patients.
So, doctor, now that we have understood, how what is asthma, how it is different from COPD, how to diagnose it, but can this be cured? And if yes, then what is the management of asthma?
Well, Dr. Sunil, that is the most common question we get in our outpatient. Can asthma be cured actually? And many people are afraid when they are told that they might have asthma. So asthma unfortunately cannot be cured. This has no cure because there is inflammation which is going to come inside of your airway. That can be controlled with the help of the inhalers which contain steroids as inhalational form. So asthma has no cure, but the good part is it can well be controlled, and the level of medication which is required to control asthma on a regular basis is very, very minimal, and people should not be bothered or concerned about the side effects which might happen due to long-term inhalational steroids, which are not, we are not giving inhalational steroids in high doses to these people who are when controlled on lower doses of steroids.
Okay. So, are there any breathing techniques, yoga, and also would you elaborate a little bit on what is the right way of using inhalers?
Right. So there are a lot of breathing techniques which people can try if they have any kind of respiratory problems, and just to make their respiratory system better on its own, even if they don't have any kind of affection. So there is something called diaphragmatic breathing. Now this is to strengthen your diaphragm, which is the muscle which is present between your abdomen and your chest. To strengthen this kind of muscle, in fact, to strengthen any kind of muscle, what you have to do is to use that muscle. उसका use करना बहुत important है. जैसे कि अगर हम अपने दिमाग को जितना use करते हैं उतना ही sharp होता है. So that is how you have to use your diaphragm also. और diaphragm को use करने का एक simple तरीका है कि आप एक हाथ अपने पेट पे रख ले, one hand on the abdomen and one hand on the chest, and start taking deep breathing in and out. And also take a lot of time to exhale your breath. This is going to exercise your diaphragm, and keep this in mind that the hand which you have kept on your chest should not move much. So that means you're not using your chest muscles to breathe in and out, rather you are using your diaphragm more in terms of helping in your breathing. So this is very simple and easy to do anywhere in between your breaks also at office, and can be practiced anywhere. Along with it, there are some pranayama exercises which are there age old, which have been proven to be very good, especially for your sinusitis, which often is associated with the asthma, and help in reducing the asthma attacks. Also, Jal Niti, which helps in clearing up of your sinuses and keeping these excessive mucus conditions at bay, so that the mucus doesn't fall on the back of your tongue and irritate your throat at all times in the day, and hence trigger an asthma attack. That could also be followed on a daily basis. Any form of exercise which is using your chest muscle or which is making your heart rate go up is going to exercise your respiratory muscles as well. So I would suggest every day 30 minutes do any kind of aerobic exercise, and in addition you can do yoga also.
On the inhaler side, Doctor, what is the right way of using inhaler? Because a lot of people make mistakes while using inhalers.
So this is a very common problem in our practice. People are not taking their inhalers in the right manner, and that is why they land up to us saying that हमें तो आपने दवा लिखी थी, लेकिन ये दवा असर नहीं कर रही है. Unfortunately, they actually don't know how to use the inhalers properly. So the right way to use any kind of inhaler, which could be in the form of a capsule, which needs to be put into your device, broken, and then inhaled, or it could be in the form of a spray, which is more commonly prescribed, which is known as an MDI spray. What you have to do is sit comfortably on a chair, which has to be upright, And then once you're opening up your inhaler, if it is the first time, discard the first 2 breaths of the inhaler, because that is how your inhaler tubings are filled up. So if you put in that inside your mouth, you're not going to get the medication right there on the first go. So once you're ready to take the inhaler, shake the inhaler well, put out the cap, keep it in your mouth, press it. I'm sure, Dr. Sunil, what I taught is that
Yes.
you have to take, so you have to take a deep, and as fast as you can, you have to take a deep breath, take the inhaler, create that kind of velocity so that the medication goes inside your breathing tubes, and then stay there for that medication to settle down inside your airway. So what people usually do is they press it, and now when they're exhaling out, they just exhale out all the medication which they had taken in their breath. So this is wrong way of doing it. If you have to take the inhaler in the right manner, you have to inhale deeply and then keep it there for some time. Many people are not able to hold their breath more than 10 seconds. 10 seconds is fair enough, but if you can do more, at least 15 to 20 seconds, and then exhale out. That is the right way of doing an inhalation. And also, please don't forget to rinse your mouth after the inhalation is done. The reason is simple. If there is deposition of the medication inside of your mouth, it is going to lead to bitter taste as well as cause certain side effects, which could be the development of white color of fungal patches inside of your mouth, which is not really good, especially in diabetics.
Yeah. So here, it is, generally people are prescribed vaccines like flu vaccines or pneumococcal vaccine in case of asthma, just to avoid any infection. Do you think there is a merit in this?
Definitely, we advise all of our patients to get vaccinated yearly for the flu vaccine, which is updated everywhere, and everybody knows this, that flu vaccines are something which are updated according to the current strain which is in circulation. Now, this could trickle down to upgrading our COVID-19 vaccines as well in the same manner, because both of them are viruses actually. So yearly we do advise flu vaccination, and every 5 years we do advise pneumococcal vaccination for our chronic respiratory patients, because these are some of the triggers. If these viral infections or bacterial infections happen again and again, they are going to cause a lot of damage to your already damaged airway. The inflammation is already there. To keep this inflammation at bay, we have to do this yearly or 5 yearly vaccination to keep the infections away from us.
Generally in media we see celebrity, those who come and they say that they have been leading normal life in sports, people talk about it. This next question is around that only. Is it like for an asthmatic to follow sports, actually playing and exercising, is it completely okay?
Well, the answer is an asthmatic can lead a completely normal life, including physical, mental, and reproductive health. This includes every aspect of your health. You're a normal person. The only thing is you might have to use an inhaler lifelong, but that is a simpler thing as compared to other problems which people often have. Don't think that it is debilitating to use an inhaler, and to keep a small kind of inhaler in your pocket or in your purse is something which you should be ashamed of. There are still people who think of this as a stigma. It should not be taken as a stigma, and every one of us know the levels of pollution which are present around us are causing these breathing issues in each and every one of us practically. Children are getting exposed to pollution right in their childhood, and this is one of the leading causes of the respiratory problems which we have in adulthood. So practically, I think these problems are going to rise, which we have seen inside our population. So you should not be ashamed of using an inhaler, and this is not a stigma. Don't think that it is going to be there for whole of your life. There are certain people who in their adolescence might be needing inhalation of these bronchodilators, but later in their age, when their airway size increases, the asthma problem often settles down.
Yeah, actually, if we see in a lot of movies, this particular scene where asthmatic patient is there, sometimes it is over dramatized, that that's leading to complete so because of that, could be that is there, plus a lot of stigma that, as you have said. But we generally see in our practice change of weather, especially during winters or certain other time. uh, we see more patients of asthma coming with they start showing symptoms. So what weather changes actually triggers asthma, and what shall we do in that case?
Right. So any change in weather which happens from winter to spring, especially because of the concentration of the pollen inside the air increases a lot. And pollens are very common triggers of asthma, as we have just spoken. Pollination season, which is happening right now, has increased the number of people who are getting wheezing in our patients. So they do increase the problem, and how this can be sorted, I'll tell you in a while. Also, the change of season from summer to winter is again the time when there would be temperature changes, and this temperature change can trigger the problem of inflammation inside of your airway. As we have spoken, strong emotions can also trigger this problem, because the emotional upheaval does lead to hormonal changes inside of your body. There are certain amount of stress hormones which are released inside the body, which can cause a lot of inflammation, not only in your airway, but all over your body. That is why we have seen those people who have depression are usually on the higher side in their weight. So weight is another problem which is very bad for asthmatics. So this chronic inflammation is not only important for asthma, it is important for other problems like coronary artery disease, for obesity. It is important for the fat deposition which happens inside of your vessels. So a lot of things which are happening. But to keep this seasonal problem at bay, what we advise our asthma patients is that once there is a change of season which is going to happen, they should take their inhalers in an increased amount 2 weeks before the season change. For example, if they were taking one puff only twice a day, they should increase it to two puffs twice a day for a period of about 2 to 4 weeks till the season change settles in, and they can lead normal lives as all of us.
Yeah, interestingly, you brought out a point about overweight leading to some of the issues with asthma. So, does that cause asthma, or what does it lead? Like, how is overweight related to asthma?
Well, it is very difficult to say whether that causes asthma or it is associated, or it can actually trigger asthma attacks. I would think that all of them together, because as we spoke, inflammation is the word. It is the word which has to be kept in mind. Inflammation is common between obesity and asthma. If you have certain kind of hormones inside your body which are going to attract the allergens inside your airway, they can trigger the asthma attacks. Also, the second reason is, as you have more fat in and around your chest, in and around your breathing tubes, as well as blood vessels, their working becomes inefficient. Now, the body has to supply a large amount of oxygen, a large amount of blood to larger surface area, which becomes a problem. So that is why obese people have narrower airway, their neck is short, they get more breathing problems. And as they have to supply blood to a very large surface area, it becomes a problematic thing for them. And especially they have problem in the night when the obstructive sleep apnea also settles in. So these are some of the associations which are there between asthma and being obese. Yes, obese people suffer more from asthma, and this could be due to the genetic factors, the excess fat, and the inflammation.
So in our practice also we see So happens that when you start taking medication, symptoms subside, and patients stop taking medication because of that. So the long-term medication is there, and then short-term medication, they stop taking any medication, and after a while, then there is the asthmatic attack, or there are symptoms that start showing up. So it becomes difficult to make asthmatic patient compliant while there is no symptom. It becomes very difficult to make them continue certain exercises and how or continue with medication or physiotherapy. What is your how can one do that? As patients, as doctor, we keep saying these things, but as patients to be compliant.
Definitely. So, as patients, our patients do have to understand as a basic point that asthma is something which can be controlled. It cannot be cured. Hence, when they are given inhalers in some amount, it controls their inflammation and gets them back on their track. But unfortunately, once somebody is back on the track, they think I'm cured for life and I have to leave these inhalers. Now, the problem is when they leave these inhalers, we have to restart from a very higher dose of inhalational steroid, which can lead to side effects in the long run. So, if they are using their inhalers in the lowest possible dose, which controls their inflammation, which is bare minimum, which can be a single puff of 200 micrograms a day, it is very minimal and it would not lead to so many side effects. They should be taught that this is the amount of the inhalational steroids which can keep their inflammation at bay. And on the other hand, if they don't use the inhaler and keep on leaving their medication, the problem is going to set in on a permanent basis, and then these inhalers are not also going to be effective in their problem. But the basic problem is that the counseling has to be done in terms of asthma being not curable and being only controllable condition. The rest of it is, as you might have seen in your practice, it is very difficult to counsel an Indian patient. They're very difficult patients. And on the other hand, certain people might have genuine problems. They can't sometimes afford these kind of inhalers also. But they have to be told that they can cut down on their unnecessary budget and keep some amount of budget for their medication, or they could be sent to some government centers where they could get their inhalers free of cost.
Yeah, and because you're talking about it not being curable, but it can be managed. We see a lot of patients coming with miraculous treatment that with tall claims like completely curing their asthma, reversing chronic conditions like diabetes, or cure. So like people get caught in this quackery sometimes. But also, how is diet and food relevant, and what kind of diet one should be on while if you're asthmatic, and what one should be avoiding?
Well, I have a belief that your body does tell you something is not good for your health. Once you eat something which is not taken up by your body very nicely, you get the indication, you get the gastritis, you get the vomiting, you get that nauseating sensation. So follow your body very, very meticulously. Your body will tell you what suits you and what doesn't suit you actually. The most important thing to avoid in asthma is cold and chilled beverages which are taken right out of the fridge and taken inside, because temperature changes, as I told you, are triggers for asthma attacks. Once you are coming in from a scorching heat inside your house and taking out a bottle of cold and chilled water and taking it in, that is going to trigger the attack. So this should be avoided at all costs by not only asthmatics, but also by people who don't have these kind of problems. So chilled water is very, very a big no for asthmatics. Also, foods that are, fast food, which have more kind of a propensity to create more inflammation inside your body, can also trigger asthma attacks. Processed foods, which have a lot of preservatives inside of them, not cooking fresh food and taking it right there, can also trigger these kind of problems, because the bacterial population which builds inside these kind of foods can cause a lot of fermentation and produce chemicals inside the food. So the basic thing is follow your body, and also freshly cooked home food is the best which has to be taken by anybody who has any health conditions. Avoiding excessive amounts of alcohol is very, very important. That causes a lot of inflammation inside the body. Also, avoiding smoking at all costs is real important. Now, this not only includes active smoking, which means that you are yourself smoking, but it also includes the passive smoking which is happening around you. There might be people who are in front of you, they are smoking, and you are being exposed to the smoke right there. So you should be avoiding smoke both actively and passively. The hookahs which are there everywhere now, there are a lot of chemicals which are present inside those hookahs, and people generally think they are not very important. They might not cause any kind of problem, but once you inhale those fumes inside of your body, they do cause a lot of problems in asthmatics. And then you have of course to avoid the amount of dust and pollution, which can be easily done by wearing masks, which has become mandatory anyway after the COVID-19 pandemic.
Yeah, and so, Doctor, despite all this, one may, suffer from asthmatic attack. So, what shall one do in that case, and what can bystanders or family can do? So, this is for not for doctor, but what is your advice for people, lay people around a person who's going through this asthma attack?
The first thing which an asthmatic should understand is that they should not stop their medication altogether on their own without the consent of their regular doctor. They should consult their doctor before they are going to stop their medication, because in certain situations we might think of stopping the inhaler for some time, but not on your own. Do not self-medicate. There are certain over-the-counter medications which might be available in the market, but they can be triggers of your asthma, and this can be true for your painkillers and aspirin also. Also, you should be having a blue inhaler, which is the SOS inhaler, which is taught to you every time you come to your doctor. It should be there right inside your purse. Or the regular brown colored inhaler which is there with you can be used at times of an acute asthma attack. Also, the more important thing is that you should not panic once you are in a place where the asthma attack has set in, and the people around you also should not panic. The doors and windows of a particular area where you are present should be open. Ventilation should be allowed, which can help to a large extent to these kind of people. And if you have help around, you can go to an emergency, get yourself checked, and there you might need some IV steroids also at that point in time. And if your attack is settled, you can go back home with the medication prescription which you will be given. But on the other hand, if the attack is more severe, sometimes people do need ICU care also. These are those kind of people who do not use their inhalers on a regular basis, but get these kind of asthma attacks every year. And sometimes the asthma attack is so severe that they have low oxygen levels and high carbon dioxide levels that lands them up right into the ICU. On the other hand, if you have a viral infection, you should take care of the symptoms in terms of decongestants, which are available over the counter. If you are suffering from COVID-like symptoms, you should be getting yourself tested and isolated, and consult your doctor at once, because at these exacerbations, you might need an increase in your inhaler strength or the amount which you are taking at that particular time. Apart from that, if your mucus is becoming more yellow, it is becoming more purulent, then you might need antibiotics, which can be prescribed by your doctor. Yes, the antibiotics are not important every time, because viral infections are not cured by antibiotics. We have seen this in COVID-19 pandemic. Everybody has been self-medicating, which should be totally avoided, because these antibiotics are preserved drugs. They should be preserved only for infections which are caused by bacteria. So these are some of the usual things which you could be doing. And in the end, I would like to emphasize the fact that learning the right technique of inhaler is very, very important to avoid these kind of in between exacerbations or problems of asthma. So if you take your inhaler in the right amount, in the right manner, and at the right place, the asthma attack is going to settle down.
This was quite an insightful session, and I'm sure that every listener who was listening to this whole session have learned that how to breathe carefree. Thank you, Dr. Vinay Kantru, to help us learning a lot about asthma.
Thank you so much, Dr. Sunil, for calling me here, and it was a pleasure interacting with you all. And in the end, to breathe carefree, I would like to advise all of you, please don't ignore your asthma symptoms. Also, please don't leave your inhalers on your own. Take up a regular exercise regime and do not eat fast food. These are some of the things which will help you breathe carefully.
Thank you, Doctor. Thank you, everyone, for watching this video. Do follow all these tips shared today to embark on your health journey. And we'll be back with another Health from Home session. Until then, stay safe, stay healthy.